on to our next presentation, and that's Natasha Larter and Seaneen Wallace. And Natasha is a Yuin woman from the South Coast. She's an Aboriginal Health Outcomes and Equity Manager at the Sydney Children's Hospital Network, and believes that elevating the voices of Aboriginal patients, families and communities is crucial in the planning, design and delivery of health policy, healthcare services and beyond discharge. Very important. And Seaneen Wallace is a proud First Nations woman from the Gungari and Bundjalung heritage. She is currently completing an Aboriginal population health traineeship with the Sydney Children's Hospital Network, and together they'll present on strategies to improve health and wellbeing of Aboriginal children and young people. So over to whoever's taken it off.
Thanks so much.
We can see it. Yep.
Yeah, awesome. Thanks so much for that introduction. So I'm Seaneen Wallace and I'm presenting today with Natasha. I'll just get Tash to introduce herself and just check that her mic and everything's working. That's okay.
Hi, thanks Shauneen. Hi everyone, I'm Tash and I'll be presenting in the last half of the presentation.
Awesome. So I would like to acknowledge the traditional custodians of the lands on which we're all meeting from today. So I myself am joining from the lands of the Bidjigal and Gadigal people of the Eora Nation, and Tash is joining us from beautiful Dharawal country. I pay my respects to elders past and present, and who give the strength and guidance to Tash and I and all of those like us. Today we're presenting on the planned evaluation of the Sydney Children's Hospital Network's Aboriginal Health Strategic Plan. And while this evaluation involves both quantitative and qualitative research, today we're focusing in on the quantitative part of that evaluation, and in particular some of the baseline ED data. Before I move on, I'd also like to acknowledge that the word Aboriginal is used in the plan and will be used in this presentation, but it does encompass both Aboriginal and Torres Strait Islander data. So it is, this work is, it seems to be frozen. Oh, there we go. So there's quite a large research team involved in this evaluation. So it's across Sydney Children's Hospital Network and some researchers from UNSW as well. There's just around 30 in total, and 12 of those are in Aboriginal investigators. So there's Tash and I, there's also some Aboriginal health workers, some senior Aboriginal management community members, which is really great to have such a strong Aboriginal research team involved in this. So the Aboriginal Health Strategic Plan, or Over Our Tracks, was developed in 2019 in consultation with Aboriginal staff, patients and communities, and represents our organisational commitment to achieving equity in health and wellbeing outcomes for Aboriginal children, young people and their communities. We try to ensure that Aboriginal people and children can live their healthiest lives possible, and it's centred around these three main chapter areas that we can see on the screen. So there's people and culture, which encompasses workforce, governance and cultural safety in environment and practice. Health outcomes and equity, which is encompassing reducing the disparities between Aboriginal and non-Aboriginal children, so closing the gap. And this involves advocacy, research, leadership and service delivery. And also partnerships, which ensures that staff and the organisation focus on forming and maintaining meaningful and trusting relationships with Aboriginal communities and organisations. So based on the New South Wales Plan, Do, Study, Act, QI methodology, the evaluation of the strategic plan will undertake a continuous cycle of evaluation using KPIs and measures across the three chapter areas. So we can see some of the evaluation KPIs on the screen. It's also important to note that since the implementation in 2018, there's been some key achievements to date. So this includes the establishment of an Aboriginal health unit and an increase in Aboriginal health workers and Aboriginal employment across the network, as well as improved Aboriginal governance structures, an increase in specific projects to improve the outcomes of Aboriginal children, and an increased effort to prioritise partnerships. A central tool developed for the quantitative analysis of the plan is the Sydney Children's Hospital Aboriginal Health Live Dashboard, and we can see a little snippet of that up in the top left-hand screen. This dashboard provides real-time de-identified patient data taken from EMR and across a range of categories such as emergency department, admitted patients and outpatients. This allows us to track operational matters such as linkages with Aboriginal health workers, length of stay, wait times and movement across departments. It also allows us to track and extract data aligning to the KPIs, and this is across physical, developmental and wellbeing domains. We can compare Aboriginal and non-Aboriginal data as well as trends over time. The dashboards allows us to answer our research questions, and the two relating to the quantitative part of the evaluation are seen on screen. We can track progress against the KPIs, identifying areas of achievement, gaps in service delivery, and inform policy research and change. So I'll hand over to Tash now, who will give us a little bit of the baseline ED data.
Thanks, Shauneen. So here we are presenting our initial findings from the analysis of the emergency department data. So our current analysis is being conducted on the admitted and outpatient data, and the whole complete analysis, including ED, outpatients and admitted patients, will then form the baseline for us to conduct the wider evaluation that Shauneen has introduced of the Aboriginal Health Strategic Plan. So during the period of 2015 to 2020, we had 13,546 Aboriginal children and young people present to the ED, and this made up 2.3% of all ED presentations. Children aged 0 to 4 made up over 50% of the presentations, and males were seen to present at a slightly higher rate compared to that of females. Over 40% of Aboriginal children accessing the ED were found to reside in the lower SES quartiles, which highlights the broad range of risks and disadvantage that these children might face, often categorising them with worse health trajectories. So as we can see from the table on the right-hand side, Aboriginal children and young people were found to present in higher triage categories, needing resuscitative, emergency or urgent care. And also worth noting is that these children were clearly presenting to the ED in much sicker conditions, with higher presentations to the ED via ambulance compared to that of other children. Aboriginal children contributed to 5.4% of all deaths in the ED. So during the total period, there were 92 deaths and 5 of them were noted as Aboriginal. So while the numbers are small, Aboriginal children are still disproportionately overrepresented. During this period, we also found that a significant number of presentations to the ED were actually unplanned representations and higher when compared to other children. Our rate of discharge against medical advice was found to be consistently lower than the state average and is not higher when compared to other children. However, it is still very important that we do understand why Aboriginal children and young people and their families are leaving before they are seen, and understand how we can make the ED a more culturally safe and responsive to the needs of the patients and families. So our qualitative analysis will allow us to explore these numbers further and determine the reasons for ED visits, presenting problems, and the reasons perhaps that our families are having delays in seeking treatment, and also the reasons for discharge against medical advice. And we plan to be able to raise awareness around the preventable injuries and implement strategies to remove possible barriers to access that are found to exist within the ED for our patients and families. Next slide.
Just seems to have frozen.
Oh, there we go. Thanks. So this is the first evaluation of our Aboriginal Health Strategic Plan, and it's also the largest evaluation of a local Aboriginal Health Strategic Plan to date. So our early successes are evident with the contributions to developments and achievements across the 3 chapters that Shauneen mentioned earlier. The chapters assist in directly documenting progress of implementation and evaluation and capture the gaps within our service delivery. It also highlights the areas where more intensive work needs to be done, perhaps even revised or developed. And it also gives us a good opportunity to just document the great work we have done or will be doing. So while the purpose of the evaluation is simple, the project in itself is much larger and much more intricate. It also gives us the power to contribute to improving health outcomes of Aboriginal children and young people and their families, backed by that real-time data that we have in the Aboriginal Health Dashboard. So our evaluation, implementation and focused research demonstrates the network's ongoing commitment to Aboriginal health in recognising the individual and collective experiences of Aboriginal people in relation to holistic care within policy and programs, planning and service delivery. As we plan to conduct more in-depth analysis of the ED data, as this is only an introduction, our non-admitted patient data and admitted patient data. Our findings from these will then guide us to more intensive research and projects based on a needs-based approach. The qualitative data collection will be undertaken using an Aboriginal patient experience survey, focus groups, one-on-one interviews, and specific surveys to answer questions that have arisen from the quantitative data analyses. And this will also allow us to understand the reasons behind such things, like, as I've mentioned, the discharge against medical advice. So I wanted to end by thanking the wider team that contributes to this project and express our gratitude to the Aboriginal children and young people, families and communities for whom we do this work to improve Aboriginal health outcomes and equity. Thank you.